in the wake of reduction of prices of 48 essential drugs. Salon today met Health Minister Dr. Rajitha Senaratne to ascertain how the minister intends ensuring that the private sector adheres to the reduced prices and his plans for the future to regulate the most expensive drugs in the private healthcare industry. In mid-October, a Gazette notification on reduced prices of 48 drugs was issued. While this is essentially a very good move, there are complaints that pharmacists, including some of the country's premium pharmacists, are not selling drugs at the reduced price. What are your plans to ensure that the directives are followed? Let me start by explaining the history of drug regulation in Sri Lanka, because people need to know the idea of controlling the prices of essential drugs is nothing new. Decades ago, the great Senator Bibal told the then Prime Minister Sirimavo Bandaranaike about the need to control the prices of drugs, and Sirimavo Bandaranaike refused his request, saying that it is impossible for the government to resist the pressure applied by the United States. And for almost 40 years no one else tried to implement Professor Bibal's pharmaceutical policy. Some of our health ministers even said Professor Bibal's policy does not suit Sri Lanka anymore because of the open economy. It seems that they didn't know that even the World Health Organization had endorsed Professor Bibal's policy by the 1980s. When President Maithripala Sirisena was the Minister of Health, he tried to implement a national drug policy, and we all know the resistance he faced. You know the story of how the file containing the draft bill disappeared at the Attorney General's office, and he was despised by Mahinda Rajapaksa, the former president, because he tried to take on the drug companies. One thing that greatly assisted me when I took up the issue was the support extended to me by President Sirisena. Even with the full support of the executive president, I still face many challenges. Some media institutions seem to be on the side of pharmaceutical companies and tobacco companies and try to give negative publicity to our endeavors. Before you proceed any further, one of the allegations leveled against the reduction of prices of drugs is the formula in which the prices are calculated. There have been reports that the ministry is using the average price, and that a proper survey had not been done prior to issuing the Gazette. Sri Lanka Chamber of Pharmaceutical Industry, SLCPI, has also accused you of inadequate consultation. I don't even know who feeds this false information to some journalists. Let me start by saying we do not use the average price to determine the price of a drug. We use the median price. And it took us close to a year to come up with the proper pricing formula, and during this time we met with almost all stakeholders, from doctors to Sri Lanka Chamber of Pharmaceutical Industry, SLCPI, representatives. In fact, I discussed the proposed pricing model in great detail with SLCPI officials on 2 occasions, and National Medicines Regulatory Authority, NMRA, officials met SLCPI representatives at least on 6 more occasions. So to say that we did not consult them is false. Moreover, we did not create this policy without study. The 48 drugs were carefully selected based on the principle of essentiality, which forms the basis of the Senator Bibal Principles on Pharmaceuticals, using the 2013/14 Essential Medicines list of the Ministry of Health. Moreover, we used IMS Health Data, a company that dominates healthcare data mining industry. Usually they charge us $5 million for their services, but they assisted us free of charge. With this data we know the production cost of a drug. We know how many people use a particular drug, and we know the profit margins. We did not bring these regulations to close down companies, and no one is leaving Sri Lanka. One of the biggest multinationals operating in the country, GSK, Glaxo, the manufacturer of a wide range of pharmaceuticals including a brand of paracetamol, Panadol, has agreed to bring down the price of this product from the current Rs 3.00 to Rs 1.30 per tablet with immediate effect. Further, they have assured uninterrupted supplies of their brands of medicines in the market, and have decided to place an advertisement in the newspapers announcing these decisions. We have to date received similar assurances from many importers of pharmaceutical products. What about the allegation that by regulating prices the government is meddling with free market access that would have an impact on investor confidence? I don't believe in allowing markets to handle the health sector, and some sectors should not be controlled by market forces. Health is one of them. I am not a neoliberal, so that is not an argument that works with me. I need to address another allegation they make. That is, we have regulated the price of innovator drugs, The first drugs created containing its specific active ingredient to receive approval for use. The truth is that not a single innovator drug has been regulated. Also, such drugs have been protected by patent rights for a long period of time, allowing them to recover the cost of R&D that has gone into developing such products, and none of the products brought under this pricing regulation are currently under patent protection. Moreover, no country depends solely on innovator medicines, and generic medicines play a significant role even in the USA, where 40% of generic and over-the-counter drugs are manufactured in India. The 2015 WHO Guideline on Pharmaceutical Pricing Policies promotes the use of generic medicines as an effective method of managing drug prices. Health Ministry regulation on pharmaceutical pricing does that by making quality generics more affordable to the public. Q. If the reduction of the prices of 48 drugs is to be the first stage of the national drug policy, what is your plan for the second stage? A. As I mentioned above, these 48 drugs are essential drugs. Initially, these drugs were identified by Professor Bibile. In 2013, we expanded this list, taking into account the new inventions. The second lot will be the most expensive drugs, including cancer drugs. We will prepare a list of these drugs and we will regulate them as we have controlled the prices of essential drugs. We have estimated that it will take about 45 weeks to properly implement the regulation of the 48 drugs. The second stage will take place after that. I also want to regulate private hospitals and nursing homes, and already I have appointed a 5-member committee to look into that. The committee is comprised of representatives from the industry and ministry officials, and I have told them that all these services need to be regulated. There are so many complaints from the people saying that these institutions charge exorbitant amounts of money from patients. We need to come up with maximum charges for procedures, because things can't go on like this. We also have plans of using these institutions for an initiative that will benefit the people. When you look at government hospitals, there are long waiting lists, especially for operating theaters. We need to clear these lists, because the lists are so long that people are dying because we can't do the procedures in time. For the first time in history, we did a survey on cost estimates of all our institutions, and we found that it is much cheaper to do a procedure at a private hospital than doing the same operation in a state sector hospital. And a lot of theaters in the private sector are idling. Also, their special facilities like the ICU are almost never at full capacity. We want to use these facilities to carry out procedures using our surgeons. We will sign a deal with these private institutions so that they will lend us their facilities at a reasonable price. This will give these institutions an additional income. If we can do these things, a lot of people will benefit, especially those who depend on the government healthcare system. Q. Getting back to the very first question I asked, what is the ministry doing to ensure that the private sector is adhering to the controlled drug prices? A. We have received complaints and I have established 2 hotlines. The numbers are 0113, 071, 073, and 0113, 092, 269, and will be answered by 2 food and drug inspectors. Once a complaint is lodged, they will notify the food and drug inspectors in the district and they will take the necessary action. When this process operates smoothly and when everyone adheres to reduced prices, we will start the second phase. Q. The funds allocated for the health ministry and the budget have been reduced. What kind of impact will that have on the ministry's plans? A. I don't think so. The finance minister told me not to worry about the health estimates because the ministry will receive a lot of funds from the proposals that I have made. He also said that he will pass any amount of money for anything related to health. Even last week he passed around Rs 40 million to educate the people on the drug policy and the reduction of essential drugs. Q. As we are talking about the budget, there seems to be a lot of contradictions between the budget proposals and how VAT has increased prices. Because of amendments, the tax that will be paid by a user of local mobile voice, SMS and value-added services has increased by 80%, and the government has increased the tax burden on data by 160%. On the other hand, there is a budget proposal for a 479% increase in the Ministry of Telecom and Digital Infrastructure. How are these two compatible? A. The VAT that was imposed is a temporary measure. When we took over the government, we realized that our debt burden was a lot higher than we assumed or what was on the books. Usually we borrow money through the treasury, but the Rajapaksa government had borrowed money through state banks to make up for the budget deficits. But we can't say that we can't pay since the money was borrowed through the banks. To address that crisis we had to increase VAT, but once this mess created by the previous government is addressed, VAT will be reduced.